Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Tolterodine. Its brand name is Detrol. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So, Tolterodine is a competitive muscarinic receptor antagonist. It binds to cholinergic muscarinic receptors that mediate the contraction of the urinary bladder. In terms of indications for use, Tolterodine is indicated to be used in the treatment of bladder muscle dysfunction, typically when it's overactive. This would typically be accompanied by symptoms of urinary frequency and urgency. Now, before somebody was to use Tolterodine, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to Tolterodine or any other component of the product, they would not be able to use this medication. They would also not be able to use Tolterodine if they had urinary retention or gastric retention. And finally, this medication cannot be used by patients who have uncontrolled narrow-angled glaucoma. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to the elderly population who have delirium or who are at risk of developing delirium because the use of this medication may worsen or induce delirium in the elderly population. We would also want to avoid giving this medication to patients who have dementia or cognitive impairment due to some of the CNS or central nervous system adverse effects that they may experience. Anaphylaxis and angioedema, sometimes requiring hospitalization, has been reported during the first dose or with subsequent doses. It should be noted that clinically significant bladder outflow obstruction has occurred. Some central nervous system anticholinergic side effects, such as dizziness or somnolence, have been reported. Sometimes patients may have to discontinue the medication or adjust their dose because of these. There's a risk of decreased gastrointestinal motility with Tolterodine. With mild to moderate hepatic or liver impairment, a dose adjustment is recommended. And the extended release formulation of Tolterodine cannot be used in patients who have severe hepatic or liver impairment. There could be a possibility for exacerbation of QT prolongation in patients who have a history of QT prolongation. Use of the extended release formulation is not recommended in patients who have renal impairment with a creatinine clearance less than 10 milliliters per minute. If the creatinine clearance is between 10 and 30 milliliters per minute, then they would want to adjust their dosage. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Tolterodine, they can expect to receive their dose orally. So if somebody's using Tolterodine to treat bladder muscle dysfunction when it's overactive, and they're using the immediate release formulation, they would typically use 2 milligrams twice daily. The dose can be eventually decreased to 1 milligram twice daily based on effects and tolerability. If they're using the extended release formulation, they would typically use 4 milligrams once daily, with the option to later decrease this to 2 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Tolterodine, so I'll go over some of those here now. 3 to 5% of patients may experience abdominal pain. Constipation may occur in 6 to 7% of patients. Dry mouth can happen between 23 and 35% of the time. And a headache may occur between 6 and 7% of the time. Now, some more rare but serious side effects would be anaphylaxis and angioedema. That's all we're going to talk about today with Tolterodine or Detrol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.